Yes.
Dr. Kueh, okay.
Yes.
Now, guys, if you are still around, I want to introduce you to Dr. Kueh, okay? Because I got to stop the recording first. Dr. Kueh is the one that he's a medical doctor, but he has such a heart for people, and he's the guy who runs, he's the mastermind behind the charity center in Malacca. That's where our Kangen water machine is there now. How was the people taking it, Dr. Kueh?
Okay. Thank you. Thank you very much, Mr. Jin. Sifu Jin. Thank you. Okay. What I did was, you see, we run a dialysis center for the poor patients in Malacca. And at the moment, what I did was, we have collected all the blood specimens from them. And that is my baseline blood level. So I'm looking at a few parameters. I'm looking at the urea level, creatinine level, potassium, sodium level, calcium level, and also phosphate level. These are the few critical levels that we look at when we treat kidney failure patients. We got renal failure patients. Hopefully, in about 3 months' time, we will repeat the parameters again and see if there's any improvement.
So
for
now
those
it just started, right?
Yeah, for those patients who are interested, they have to sign a consent form. This is considered as a study, So they have to sign the consent so that I can collect the data. Whereas some who are considering, they refuse to sign the consent, I still give them the water. It's not that if they don't sign up, we don't give. That's wrong. We give to everyone. Unless those who suspect the water may kill them and they don't want it, then I won't force it on them. Yes, there's one patient who refused it, So never mind, let this patient see the rest of them improve.
Yep.
And eventually, if this patient wants it, then I think that's our success.
Dr. Kueh, I think I have someone that to share with you her experience of her mother, which is also a dialysis patient. Rachel, are you there? Maybe you can share your mother's experience, Rachel.
Is Rachel still around?
Yeah. Dr. Kueh, maybe you can listen. Rachel, you have to unmute yourself.
Rachel.
Yeah. Her mother has been doing dialysis for years, right? Rachel, maybe you can just share your mother's testimony.
Yeah, my mother already doing the dialysis about 10 years. And I bought the machine last year, September. So actually, I not really realized until every 3 months, I need to bring my mom to check up every 3 months at the HKL. And she only can drink 500 ml every day maximum. So surprisingly, that diabetic insulin doctor asked to reduce because she feel that dizzy, or middle of the night she wake up to make Milo to drink, things like that. So from them is every 3 months from 12. Now is last month is totally no need to inject insulin no more. For her diabetic. Yeah,
wait. I didn't hear it. One more time. You say no more injection, insulin.
No more injection for insulin.
Is she taking any pills now?
The pills still have to continue, but
pills continue, but insulin no more. Wow.
Yes. Yeah.
What did the doctor say? Is it very common to no need insulin?
Actually, for dialysis patients, some after the dialysis, the diabetics will reduce. Depends to the patient. But all the while, my mom didn't reduce. Still have to observe what are the things that in changes, because she didn't change her diet. She eat what she like. We give her what she want to eat because she already we didn't control that. We only control on the water that she consume, because she cannot over consume the water. That's the only thing that we do it. Then other than that is same can see that she have more energy. The face of the complexion is look even better. not so dark compared with last time. Yeah, this is what we
Wow, that
see.
was great news, Rachel. You know what? Sabah here is going to have a by-election again. One YB just passed away, kidney failure. So when I look at it, hello, we could have helped, but they don't know. There's something we can do. Many people doesn't know.
Okay, that's an interesting sharing, Rachel. Thank you very much. I learned something from you. So in my study, I would tell my head of department to watch out for drop of sugar level in the patients are taking 100 water, because when the sugar level is too low, they may go into fits, and they may collapse as well. So I think there's something look into. Dialysis patient, normally the sugar level and whatnot will not change much, unless they have other intervention. But again, Rachel, your mom is doing hemodialysis, right? Using machine, right? Using machine, they wash the blood.
Yes, it's not the water one. It's the
Not the water one.
It's the blood. Yeah.
Because now actually my what they call that charity body, we are also doing what we call CAPD. That's what we mean by using water. This group of patients, I'm also going to start a study on them using this Kangen water. But the problem with them is they dialyze at home. They don't need to come to our center. So if we want them to come to the center every other day to take 2 bottles of water and go home and drink, it might be a bit difficult. So I'll try to get a few of them who are near to our center, who are motivated enough. I am sure I can get one. Because this lady actually is very young. She's 38 years old. Just started on CAPD about 2 weeks ago. She's lucky enough.
If those who are young and let's say they also control their diet, it will help more actually.
You see, CAPD is better than HD because we do not restrict their fluid too much, and they can eat freely. Compared to HD, I am sure your doctor will tell you cannot take citrus fruits, no oranges, green veggie, you have to chop it up and then, rinse it properly, get rid of the chlorophyll, and a lot of things you can't take, right now. Yeah. Whereas CAPD patients, we encourage them to take oranges because they tend to have low potassium level when they go for CAPD. So in fact, I've got a patient who calls us up at night and say she has cramps. And we suspect that her potassium is low. So the only thing is we ask her to take 2 oranges and that solves the cramp problem.
Oh, okay.
Whereas if your mother on HD, I will tell her stop the oranges. Don't ever touch.
No, she will just eat whatever she like, but we control the portion actually. Because
with CAPD, they can actually have more freedom in their food, and they can take slightly more water compared to HD patients.
Yeah, and one more thing I want to add is for the past 1 year, she don't have like others complication like last time before we drink the Kangen water, she will have this lung infection, things like that, like urgent need to go to the hospital. But I realized that because the day my sister need the hospital bill, then only I noticed for the past year that we didn't go to the hospital.
Oh, good. The other thing I want you to watch out for is whether her calcium level improves. Calcium and phosphate.
Is still trying some new medicine. We'll see coming another 1 month. I'm going to see the doctor again. So now she already the doctor changed another for the calcium. So I'll
because if I take the measurement above, 佢可以擠4個。
Right, Desmond, you're saying something, is it? No. Okay. Okay.
So now I will monitor on the calcium area.
Yeah, that would be an interesting parameter to look at. Because if the phosphate level goes down and the calcium maintained in a normal level, you can see that her bone health will improve.
But not yet.
Because normally dialysis patient after dialyzing for a number of years, they start complaining of pain in the legs, and that's where they develop osteoporosis. So
Correct.
this is something I don't like to see, and they end up with fractures here and there.
Yeah, correct.
All right, Rachel.
Okay.
Rachel. Sorry, there is a question here. Someone was asking what pH then you give your mom to drink.
9.5
9.5. How old is she?
or 78.
78. 9.5. Yeah. So Eunice 9.5. Actually, there's no secret to it. 9.5 is the every one of us we drink 9.5. Right. So some of them, if they can take 11.5, you can introduce some 11.5. If not, the answer is 9.5. Right.
Rachel, are you still limiting her drink to 500 ml per day?
Actually, I believe she drink more than that.
I have not got a single patient who drink 500.
Because we didn't measure actually, but I believe she drink more than that lah. Sometimes she take by herself, then we do not know lah.
Right, Dr. Kueh. So if you have long enough with us, right? Actually, this is not uncommon. Rachel's mom's case is not uncommon. Very common. People who cannot drink normally they drink more than 500, they will actually have a bloated. They have water retention, right? Not Kangen water. Actually, they cannot. They can notice that their pee actually more fluent, and more pee, and they don't have water retention. But of course, we still tell them to start with 500 ml. Just in case some people they'll go back and then, okay, want to drink 3 liters of Kangen water.
No, don't do that. Okay, always ask them just follow the.
Yeah, but after a couple of months, after a few months, they can increase. It's quite common in our case. That's when they see their energy level comes back. The general health being actually really improved lah. It's quite common. So here's the thing: the creatine, a lot of them they improve also. But it will be good lah in your charity center if we can have more. Samples, cases,
We are collecting data. I think that those are more things that we look into data. Before evidence-based sort of things,
Yep.
So I may also look at the fluid extraction, whether we need to reduce the fluid extraction when they put on Kangen water.
Okay. So,
doctor, sorry, I add one more thing. But when she take medicine, we give her this pH 7.
Oh, the
medicines,
plain water.
Yes, when she take the medicine.
Yeah. Because sometimes some of this medicine they cannot work in alkaline media.
Correct.
Maybe for your patient, you have to
make in such a way, because you see, when you take the medicine, it will go into your stomach, and a lot of people know in the stomach is gastric acid. So a lot of pills are tailored made in such a way that they have to bypass this this acidic environment before they go into action. And if it's alkaline in the stomach, it won't activate the medicine. So that's the reason why we prefer them to take under pH 7.
Yeah. You just ask them to drink their normal water because it's like aspirin or 7, what, all this, they will confuse.
Okay. So ahead, next Monday 8:30, we're going to have our testimony night, right? So that is Rachel, get ready. Maybe even show us some photos of your mom, happy photo. Next Monday, it will be in Mandarin. Next Monday one. That will be the time for all our members to share their own testimonies. That will be interesting one. So normally you have a testimony like that, you can hear all kinds of things from diabetes, the blood sugar level drops, you're talking about cholesterol drops, hypertension. You're talking about people who have cancer may share their testimonies, or even you will see people just come and share how they lose weight. You know, after so many years, just by drinking water, they lose weight.
For your information, Sifu Jin, I've started 2 patients on our gastric protocol.
Oh, okay.
And
how do you drink
both of them, excellent result.
Whoa.
Excellent. I'm getting very good result from these 2 patients. I'm starting a 3rd one tomorrow. So
actually, I'm interested to see all your nurses. They should be the one that rajin me know and bringing good results.
Hiya, my nurse you know, I bring the water to the clinic, ask them to drink. I bring back the water and drink it myself.
Ayo.
They refuse to touch.
Refuse Walao.
Yes. I told them, I said, you know, who would offer you such things free of charge? I don't know why. Maybe sorry lah, they are Muslim. So they may think that my container may not be halal or whatever. Although they may not say anything lah. In fact, they won't touch my food. So that could be the reason lah.
Yeah.
But the container I use it's not container from my home. You know the dialysis center next door. I use the dialysis bottle.
Oh.
Clean it. Then we use that as the bottle. So it has not touched anything else except water. But yet, they just smile and then refuse to say anything. So I wouldn't force it on them.
Oh, that's in your private
the dialysis center, all the nurses take home. The dialysis center, the one you gave to me in the dialysis center. They all take home. Initially, they drink. And when I went back and checked on them and said, have you started on the patient? I said, not yet. They said, what is the water for? They start laughing. They say, for ourselves. I told them, it's for the patient. You are getting it as bonus only.
Great.
So, all the nurses in the dialysis center are taking them. But my own 2 nurses in my clinic, they refuse to take it. So, I don't know why.
Good.